question I get routinely is how someone knows how much weight is too much that they're using when they're lifting. I think the biggest thing we always tell people from an orthopedic kind of standpoint is that you want to do everything in a progressive nature. The problem is a lot of people haven't been in the gym in a while. They go back in and they try to do really heavy weights really quick, which is a big mistake. Everything we tell people to do is really controlled weights. Don't push things too hard, and then every week kind of increase your weight as long as it's not causing any pain or discomfort. The biggest thing we're always separating in orthopedics is, are you just having muscle soreness from increasing your activity, or have you done something to really damage your shoulder? And specifically, you can really tell that is if you've done something and you do a sudden movement and then you have sudden pain associated with that, then we get more concerned about a true shoulder injury versus going through your workout and then the next couple days being sore just from exercising muscles you haven't really used before. So a big question we always get is about how do I use proper form when I'm in the gym? And we always tell people there's a lot of resources out there. Trainers nowadays are so highly trained and so professional in what they're able to do. We always recommend trainers. There's also a ton of information actually online to show you proper form. And the smartest thing to do is start out with a lower weight that you can actually learn the form. As you perfect the form, then you can increase your weight. Many times some people come and see us immediately after they injure themselves if it's a significant injury, meaning to the point they've lifted something and now they can't lift their arm and the pain is so severe they come in within the first 24 to 48 hours. Most people, when they injure their shoulder, it's a little bit more of a kind of a subacute kind of feeling that something just doesn't feel right. Most people give it about a week or so. They rest it, they use some ice, they take some over-the-counter anti-inflammatories such as Motrin or something, low-dose pain medications like Tylenol, and then a week after or 2 weeks after, if it's still just as painful, that's when most people seek out a specialist. I think if you're working out and all of a sudden you've done something and you have a terrible pain in your shoulder, I think you want to first evaluate what were you doing that caused that pain. If it's just a minimal amount of pain, a lot of people end up dropping the weight back down to a level where it's not painful. If it's excruciatingly painful to the point where you can't finish your workout, that's when we definitely recommend stopping your workout, icing down your shoulder, taking some anti-inflammatories. If the pain's even worse, you can take some Tylenol, and then see how it progresses. Many times, if it's pain that kind of comes and goes, then you can return to your workout in a couple days. If the pain persists, that's when we want you to come see us so we can give you a proper diagnosis and get you better.